Your blood sugar reading this morning was 240, then 190 after lunch. By evening, it's dropped to 85, and you're feeling dizzy and confused. Does this sound familiar? If you're experiencing these dangerous blood sugar swings, what I'm about to share with you in the next few minutes could quite literally save your life. Because here's what most doctors won't tell you. Uncontrolled diabetes doesn't just make you feel tired. It's silently damaging your kidneys, your eyes, your heart, and your nerves right now, at this very moment. I'm Dr. Min-Jun Carter, and over my 25 years specializing in senior health, I've seen too many patients lose their vision, undergo amputations, or suffer heart attacks, all because they didn't understand the simple, practical steps that keep blood sugar stable. But here's the good news. It doesn't have to be that way. Stay with me, because today I'm going to walk you through the exact strategies that have helped thousands of my senior patients take control of their diabetes and live full, active lives. Section 1. Understanding the silent danger. Let me start by being completely honest with you. Diabetes in your senior years is different and in many ways more dangerous than diabetes in younger people. And here's why. First, you need to understand what's actually happening inside your body. When you eat, your food breaks down into glucose. That's blood sugar. Your pancreas is supposed to release insulin, which acts like a key that unlocks your cells so the glucose can get inside and give you energy. But with type 2 diabetes, which affects about 90% of seniors with diabetes, one of two things happens. Either your pancreas doesn't make enough insulin anymore, or your cells have become resistant to it. They've changed the locks, so to speak, and the insulin key doesn't work as well. The result? That glucose stays in your bloodstream, and this is where the real damage begins. High blood sugar acts like tiny shards of glass flowing through your blood vessels. Day after day, week after week, it's scraping and damaging the delicate lining of your arteries, your capillaries, your nerves. Why it's more dangerous for seniors. Now here's what makes this especially critical for those of us over 65. As we age, several things happen that make diabetes more challenging. Number 1, you may not feel the warning signs as clearly. That tingling in your feet that warns of nerve damage? Many seniors have reduced sensation and miss these early warnings. Number 2, your kidneys don't filter as efficiently as they once did. This means diabetic kidney damage progresses faster and can lead to dialysis. Number 3, you're likely taking multiple medications for other conditions. These can interact with diabetes medications or affect your blood sugar in ways you don't realize. And number 4, low blood sugar episodes, hypoglycemia, are more dangerous. A severe low can cause falls, confusion, or even mimic a stroke. I've had patients rushed to the emergency room because family members thought they were having a stroke, when actually their blood sugar had dropped too low. Section 2. The critical numbers you need to know. All right, let's talk about the numbers that matter. And I want you to grab a pen and paper right now. Yes, pause the video if you need to, because these numbers could make the difference between healthy aging and serious complications. Your target blood sugar ranges. For most seniors, we want to see fasting blood sugar first thing in the morning, before eating, between 90 and 130 milligrams per deciliter. After meals, 1 to 2 hours after eating, less than 180 milligrams per deciliter. At bedtime, between 100 and 140 milligrams per deciliter. Now write this down. If your numbers are consistently above these targets, your diabetes is not well controlled and damage is occurring. The A1C test. But there's another number that's even more important, your A1C. This is a blood test that shows your average blood sugar over the past 2 to 3 months. It's like a report card for your diabetes management. For most seniors, we aim for an A1C between 7 and 8%. That's slightly higher than the 6.5% we target in younger adults. And there's a very good reason for this. We want to avoid dangerous low blood sugar episodes, which can be life-threatening for seniors. If your A1C is over 8%, we need to make changes. If it's over 9%, we need to make changes urgently. Blood pressure and cholesterol. Here's something critical that many people don't realize. Managing diabetes isn't just about blood sugar. You also need to monitor. Blood pressure should be below 140/90, ideally around 130/80. LDL cholesterol, the bad cholesterol, should be below 100. Triglycerides should be below 150. Why? Because diabetes dramatically increases your risk of heart disease and stroke. In fact, about 2/3 of people with diabetes die from heart disease or stroke. So controlling these numbers is just as important as controlling your blood sugar. Section 3. Practical strategies to keep blood sugar stable. Now, we get to the heart of today's discussion. The practical, actionable strategies that will help you keep your blood sugar stable and prevent those dangerous spikes and drops. Strategy number 1. Master the timing and composition of your meals. This is absolutely crucial, and it's where I see most seniors making critical mistakes. Eat at consistent times every day. Your body thrives on routine. When you eat breakfast at 7 a.m. one day, 10 a.m. the next, and skip it entirely the third day, your blood sugar goes on a roller coaster ride. Here's what I recommend. Breakfast within 1 hour of waking up, lunch 4 to 5 hours later, dinner 5 to 6 hours after lunch, a small snack before bed if your bedtime reading is below 120. The plate method is your best friend. Picture your plate divided into sections. Half your plate, non-starchy vegetables, broccoli, spinach, peppers, green beans, cauliflower. 1/4, lean protein, chicken, fish, turkey, eggs, tofu. 1/4, complex carbohydrates, brown rice, quinoa, sweet potato, whole grain bread. This naturally balances your meal and prevents blood sugar spikes. Never eat carbohydrates alone. This is a game changer. If you eat a piece of toast by itself, your blood sugar will spike rapidly. But if you eat that toast with scrambled eggs and avocado, the protein and fat slow down the absorption of the carbohydrates, and your blood sugar rises gradually and stays stable. Strategy number 2. Understanding and choosing the right carbohydrates. Not all carbohydrates are created equal. Some will send your blood sugar skyrocketing, while others provide steady, stable energy. High glycemic foods, avoid or limit these: white bread, white rice, white pasta, sugary cereals and pastries, regular sodas and fruit juices, potatoes, especially mashed or baked, candy and desserts. Low glycemic foods, choose these instead. Steel-cut oatmeal, whole grain breads. Look for whole grain as the first ingredient. Brown rice, quinoa, barley, most vegetables, legumes, beans, lentils, chickpeas, nuts and seeds. Here's a practical tip. When you're shopping, if a food is white and processed, it's probably going to spike your blood sugar. Choose colorful, whole foods instead. Strategy number 3. The power of physical activity. I know, you've heard this before, but let me explain why exercise is so powerful for diabetes and then give you realistic options that work for seniors. When you move your muscles, they pull glucose out of your bloodstream for energy without needing insulin. Exercise is like a natural insulin shot. Just a 15-minute walk after a meal can lower your blood sugar by 20 to 30 points. The best types of exercise for blood sugar control. Walking. Aim for 30 minutes most days. Break it into 3 10-minute walks if that's easier, after breakfast, lunch, and dinner. Resistance training. Using light weights or resistance bands 2 to 3 times per week helps build muscle. More muscle means better blood sugar control. Chair exercises. If mobility is limited, seated exercises can still be very effective. Water aerobics. Excellent for those with joint pain or balance issues. X. Important safety note. Always check your blood sugar before exercising. If it's below 100, have a small snack first. If you take insulin or certain diabetes medications, talk to your doctor about adjusting doses on exercise days. Strategy number 4. Medication management for seniors. Let's talk about medications. Many seniors are on multiple drugs, and this can get confusing and even dangerous if not managed properly. Common diabetes medications for seniors. Metformin, usually the first medication prescribed. Generally safe, but can cause stomach upset. Take with food. Tell your doctor if you're having kidney problems. Sulfonylureas, like glipizide or glyburide. These stimulate your pancreas to produce more insulin. Important warning, these can cause dangerous low blood sugar, especially if you skip meals. DPP-4 inhibitors, like Januvia, gentle option with low risk of hypoglycemia. Good for seniors. GLP-1 agonists, like Ozempic, Trulicity. Injectable medications that help with blood sugar and weight loss. Generally safe for seniors. Insulin, sometimes necessary. If you're on insulin, you must monitor your blood sugar regularly and learn to recognize signs of low blood sugar. Critical medication safety tips. Use a pill organizer with days of the week. Fill it once a week at the same time. Keep an updated list of all your medications, including over-the-counter drugs and supplements. Bring this to every doctor appointment. Never stop or adjust diabetes medications without talking to your doctor first. Be aware that some common medications can raise blood sugar. Steroids, prednisone, some blood pressure medications, and even certain antibiotics. Set phone alarms to remind you when to take medications. Strategy number 5. Monitoring and pattern recognition. Knowledge is power. The more you understand your body's patterns, the better you can control your diabetes. How often to check your blood sugar? If you're on insulin, typically before meals and at bedtime, so 4 times daily. If you're on oral medications, your doctor may recommend 1 to 2 times daily, rotating times to see different patterns. If you're managing with diet and exercise alone, several times per week at different times. Keep a simple log. Write down blood sugar reading, time of day, what you ate, any exercise, how you're feeling, any medications taken. After a week or 2, you'll start to see patterns. Maybe your blood sugar is always high in the morning. That's the dawn phenomenon, and we can adjust your evening medication. Maybe it spikes after pasta, but not after brown rice. Now you know what works for your body. Learn to recognize low blood sugar symptoms, shakiness or trembling, sweating, rapid heartbeat, confusion or difficulty concentrating, dizziness, hunger, irritability, or mood changes. If you experience these symptoms, check your blood sugar immediately. If it's below 70, follow the 15-15 rule. Eat 15 grams of fast-acting carbohydrates, 4 glucose tablets, half a cup of juice, or 1 tablespoon of honey. Wait 15 minutes and check again. Strategy number 6, stress and sleep management. Here's something that surprises many people. Stress and poor sleep can raise your blood sugar significantly. When you're stressed, your body releases hormones like cortisol and adrenaline. These hormones tell your liver to release stored glucose, preparing you for fight or flight. But if you're just sitting and worrying, that glucose has nowhere to go. Stress management techniques, deep breathing exercises, 5 minutes, 3 times daily, gentle yoga or Tai Chi, meditation, or prayer, engaging in hobbies you enjoy, staying socially connected with friends and family. Sleep is equally important. Poor sleep makes your body more insulin resistant. Aim for 7 to 8 hours per night. If you have sleep apnea, get it treated. It has a huge impact on blood sugar control. Strategy number 7, hydration. This is simple but often overlooked. When you're dehydrated, your blood sugar becomes more concentrated and reads higher. Aim for 6 to 8 glasses of water daily. If plain water is boring, try water with lemon or cucumber slices, unsweetened herbal tea, sparkling water with no added sugar. Avoid regular sodas, sweet tea, and fruit juices. These are basically sugar water and will spike your blood sugar dramatically. Section 4. Preventing complications. Now let's talk about preventing the serious complications of diabetes. Because here's the truth. Well-controlled diabetes doesn't have to lead to blindness, kidney failure, or amputations. These complications are preventable. Protecting your eyes. Diabetes is the leading cause of blindness in adults. But here's what you need to know. Diabetic eye disease often has no symptoms in the early stages. What you must do. Get a comprehensive dilated eye exam every year without fail. Keep your blood sugar and blood pressure well controlled. Report any vision changes immediately. Blurriness, floaters, flashes of light, or spots. Early detection and treatment can prevent 90% of diabetes-related blindness. Protecting your kidneys. Your kidneys filter about 50 gallons of blood every single day. Diabetes can damage these filters. What you must do. Get your urine checked for protein, microalbumin, annually. Get your kidney function blood test, creatinine and eGFR, at least annually. Control your blood pressure strictly. Stay hydrated. Avoid NSAIDs, ibuprofen, naproxen when possible. They can harm kidneys. Protecting your feet. This is critical. Diabetes can damage the nerves in your feet, causing numbness. You could step on something sharp and not feel it. A small cut can become infected and in serious cases lead to amputation. Daily foot care routine. Every single evening, inspect your feet carefully. Use a mirror to see the bottoms. Look for cuts, blisters, redness, or swelling. Wash your feet with warm, not hot, water and mild soap. Dry thoroughly, especially between the toes. Apply moisturizer, but not between the toes. Check your shoes for pebbles or rough spots inside before wearing them. Other important foot care tips. Never walk barefoot, even at home. Wear properly fitted shoes with good support. Wear clean, dry socks every day. White socks are best so you can see any drainage. See a podiatrist for nail trimming if you have vision problems or can't reach your feet easily. Get a comprehensive foot exam from your doctor at least once a year. Protecting your heart. As I mentioned earlier, heart disease is the #1 killer of people with diabetes. Heart protection strategies. Take a daily aspirin if your doctor recommends it. Keep your LDL cholesterol below 100. You may need a statin medication. Control blood pressure strictly. Don't smoke. If you do, quit now. It's never too late. Stay active. Manage stress. Know the warning signs of a heart attack. Chest pressure or pain. Shortness of breath. Pain in arms, back, neck, jaw, or stomach. Nausea or lightheadedness. Cold sweat. Don't wait. Call 911 immediately if you experience these symptoms. Section 5. Creating your personalized action plan. All right, we've covered a lot of information. Now I want to help you create a simple, personalized action plan that you can start implementing today. Step 1. Know your current numbers. If you don't know your most recent A1C, blood pressure, and cholesterol numbers, call your doctor's office tomorrow and ask for them. Write them down. These are your baseline. Step 2. Choose one thing to improve this week. Don't try to change everything at once. That's overwhelming and sets you up for failure. Pick one thing from this list to focus on this week. Start checking my blood sugar at consistent times and keeping a log. Add a 10-minute walk after dinner every evening. Use the plate method at lunch and dinner. Cut out regular soda and replace it with water or unsweetened tea. Set up a pill organizer and medication reminders. Schedule my annual eye exam. Step 3. Add one more change next week. Once that first change becomes a habit, add another one. Small, consistent changes add up to dramatic results over time. Step 4. Build your support team. You shouldn't manage diabetes alone. Your team should include your primary care doctor or endocrinologist, a certified diabetes educator, a registered dietitian, an eye doctor, a podiatrist, family or friends who can support you. Don't hesitate to ask for help. That's what healthcare professionals are here for. Step 5. Plan for challenges. Life happens. You'll face situations that make diabetes management harder. Holidays, illness, travel, stress. Plan ahead. For holidays, decide in advance how you'll handle sweets and large meals. For illness, know that illness raises blood sugar. Check more often and stay hydrated. For travel, pack twice as much medication and supplies as you think you'll need. Carry them in your hand luggage. Never checked bags. For stress, have your stress reduction techniques ready to use. Step 6. Celebrate your successes. When your blood sugar readings improve, when you lose a few pounds, when you walk further than you could last month, celebrate these victories. You're taking control of your health, and that deserves recognition. Section 6. Special situations and common questions. Let me address some common situations and questions I hear frequently from my senior patients. My blood sugar is perfect all day, but high every morning. Why? This is called the dawn phenomenon. Your body naturally releases hormones between 4 and 8 a.m. that raise blood sugar to prepare you for the day. Solutions include a small protein snack before bed, exercise in the evening, adjusting your evening medication timing. Talk to your doctor about what's best for you. I'm losing weight without trying. Is this good? Unexpected weight loss can be a sign that your diabetes is poorly controlled. When your cells can't get glucose from your blood, your body starts breaking down muscle and fat for energy. See your doctor promptly. Can I ever eat sweets again? You don't have to give up all treats forever. The key is moderation and timing. Keep portions very small. Have sweets after a balanced meal. Never alone. Save them for special occasions, not daily treats. Consider sugar-free alternatives, but watch the calories. I'm afraid of insulin. Does needing insulin mean I failed? Absolutely not. Type 2 diabetes is a progressive condition. Over time, your pancreas may produce less insulin. Needing insulin doesn't mean you've done anything wrong. It's just the nature of the disease. Insulin can actually help you feel much better and prevent complications. My doctor wants my blood sugar lower, but I keep having lows. What should I do? This is a crucial conversation to have with your doctor. For seniors, avoiding dangerous lows is more important than achieving perfect numbers. Your target may need to be adjusted. Never suffer in silence. Speak up about hypoglycemia episodes. Listen, I know this was a lot of information, and I know that managing diabetes, especially as we get older, can feel overwhelming. Some days you'll do everything right and your numbers still won't cooperate. Some days you'll feel frustrated or discouraged. But here's what I want you to remember. Every single positive choice you make matters. Every healthy meal, every walk around the block, every time you check your blood sugar and adjust accordingly, all of these are protecting your body from damage. You're preventing heart attacks, kidney failure, blindness, and amputations. You don't have to be perfect. Nobody is. You just have to be consistent and persistent. I've been working with senior patients for over 25 years, And I can tell you with absolute certainty, it's never too late to improve your diabetes control. I've seen patients in their 70s and 80s dramatically lower their A1C, get off multiple medications, and feel better than they have in years, all by implementing the strategies we discussed today. Your next steps? Here's what I want you to do right now before you close this video. 1. Write down your most recent blood sugar reading and your A1C if you know it. 2. Choose one strategy from today's video that you'll start implementing this week. Just one. 3. Schedule an appointment with your doctor if you haven't had a complete diabetes checkup in the past 3 months. 4. Share this video with a friend or family member who also has diabetes. We're stronger when we support each other. And please, if you found this information helpful, subscribe to Dr. Carter's Senior Health Guide. I post new videos every week, covering the health topics that matter most to seniors, from heart health to arthritis to memory and everything in between. Click that bell icon so you're notified when I post new content. And if you have questions or topics you'd like me to cover, leave them in the comments below. I read every single one. And your questions help me create content that truly serves this community. Remember, you're not just managing diabetes. You're investing in quality years ahead. Years to spend with grandchildren, to travel, to pursue hobbies, to enjoy life. That's what this is all about. I'm Dr. Min-Jun Carter, and I'll see you in the next video. Until then, take care of yourself. You're worth it. Disclaimer. This video is for educational purposes only and is not a substitute for professional medical advice. Always consult with your healthcare provider before making changes to your diabetes management plan. Emergency numbers. If experiencing severe hypoglycemia, chest pain, or other medical emergency, call 911 immediately.